Namaste, I'm Dr. Vinod and I hope you're doing well. In my previous videos, I had talked about various orthopedic conditions, the symptoms that one might experience with these conditions, and also demonstrated some simple exercises that can be done to mitigate the symptoms when they occur. Now, all of these videos have been quite informative. I believe that they are quite long, and hence from now on, for the next series, I would like to make a series of videos which are shorter, which focuses on one particular orthopedic problem and gives you information about the symptoms, the pathophysiology, and what treatment options there are for this condition. The first of these videos, I'll be talking about something called a meniscal tear or a meniscal injury of the knee joint. This is a fairly common problem and many people suffer from it. So let's get started.
So what is this meniscus that we keep talking about? For this we need to quickly run through the anatomy of the knee. The knee joint is formed by the lower end of the thigh bone, the upper end of the shin bone, and then you have the kneecap of the patella in the front, which is the bony prominence that you find in the front of the knee. But now these surfaces inside the knee joint is lined by something called the articular cartilage, which is a smooth lining, which is firm in consistency, and then you have the joint fluid, which is a lubricating fluid, which helps in friction-free movement of the joint. What structures you see here are the meniscus, which are the curved structures, which are a different form of cartilage, which is more elastic and more flexible, and this have an important role and function. The meniscus helps to increase the area of contact between the curved lower end of the thigh bone and the flat upper end of the shin bone. It also helps to spread the shocks better, and also helps in weight distribution and improving the congruity of the knee joint. It may also help to spread the synovial fluid on the surface of the articular cartilage, thereby providing nourishment to the cartilage and also distributing the loads. So the meniscus has a very, very crucial function inside the knee joint. So what causes a meniscal tear? The meniscal tears can be classified as an acute injury or a chronic degenerative tear. If a bent knee is loaded and twisted, then that results in shearing forces going across the meniscus, resulting in a meniscal tear. Of course, if the meniscus is already slightly degenerate, if it's lost its normal elasticity and suppleness, then the chance of getting a tear is much higher. An acute tear usually happens as a result of jumping and landing and twisting your knee, or if you've been sitting for a long time and then standing up and twisting your knee, or very commonly people coming downstairs or going upstairs and then twisting the knee awkwardly, resulting in an acute tear. A chronic tear usually happens as a result of degeneration. Over time, as we all age, the meniscus undergoes degeneration. It loses its normal suppleness and elasticity, and this results in a higher chance of getting a chronic tear over time. Now, if the tear happens in the region of the meniscus which has got a good blood supply, which is near the periphery or the rim of the meniscus, then the chances are that it will heal on its own if you just rest the knee and do not aggravate the condition. Whereas if the tear is further inside the meniscal body, then the structural integrity of the meniscus is lost, and it not only causes pain, but also the meniscus does not function the way it's meant to be. So something more needs doing in such cases. So what are the symptoms of a meniscal injury? What are the things that you might experience if you have a meniscal injury? If it's an acute injury, then the patient usually experiences a severe, sharp, acute pain in the knee, usually on the inner aspect of the knee, sometimes on the outer aspect of the knee. And there might be swelling which comes on gradually over time during the day after the injury. Sometimes the knee may lock, as in the person might not be able to straighten out the knee fully, and may also limp when walking. The pain can come on when bending the knee, especially if you bend the knee more than 90 degrees or a right angle. And there may also be a painful click which happens from time to time from inside the knee when you're walking or bending the knee. These are the common symptoms that usually happens as in an acute meniscal tear. If it's a chronic tear, then usually the symptoms slowly develop over time. There may be initially only mild pain, especially on walking longer distances, which is an indication that the meniscus is degenerate. But then gradually over time you might get symptoms such as clicking sensation, which are painful. There might be difficulty in bending your knee fully, or pain when climbing stairs, coming downstairs. So what should you do when you first get a knee injury? If you have a knee injury, then follow the acronym initially of RICE, which is rested. You ice the part or apply cold packs. You apply some kind of a compression bandage or a brace to support your knee, and you elevate the limb when resting so as to reduce the swelling. It is important that you move the knee gently through a range of movement to keep the knee moving, but do not force the matter. If needed, use a crutch for support while walking, and analgesics can be taken as needed to reduce the pain and inflammation, and then you might need to get your knee checked out with an orthopedician as soon as you're comfortable and as soon as possible. It's important that you don't ignore the problem, because it could lead to further issues. It could be there could be something more than just a simple knee sprain, which is the most common. Or it could lead to a persistent problem if you ignore it, interfering and delaying your return to normal activities and function. So what happens if the MRI scan picks up a tear? If it's a small tear, then it can be left alone, and it might heal up over time if left with treated with rest and rehabilitation. But the problem with these small tears are that some of them can propagate and turn into larger tears, causing a problem later on if left alone. In case of a larger tear or a more complex tear, then the decision is fairly straightforward, in which case you will need an arthroscopic or a keyhole surgery of the knee. But the decision on whether to repair the tear or to do a partial meniscectomy, wherein we remove a portion of the meniscus and leave the rest of it alone, will depend upon the location of the tear, really, because if the location is in an area which has got a good blood supply, then the healing potential is good, in which case it may be amenable to repairing. If it is in any other part of the meniscus which doesn't have a good blood supply, then the best course of action might be to excise or remove that diseased portion of the meniscus and then smoothen what's left of the meniscus. Now, the keyhole surgery or an arthroscopic surgery of the knee is usually a day case procedure, but sometimes you might need to stay in maximum an overnight stay in the hospital for the procedure. The post-surgery rehabilitation is extremely important. Initially, you might have a crutch to support your knee while walking, but you'll soon get rid of the crutch and you might start yourself on the rehab and exercise program with the physiotherapist in order to get you back to your normal functioning. In a very straightforward case, usually you can expect to return to normal function within 2 to 4 weeks of having the operation. Of course, playing sports might depend upon how well you rehabilitate, and that might take a bit longer. So that was a quick run through about meniscal injuries. If you have found this informative and the video useful, then please don't forget to click the like button, share the videos with people who might find this useful, and also subscribe to my channel if not done already. In the next few weeks, I'll be coming up with more videos of this kind with focused information about various orthopedic conditions. So as always, keep fit, keep moving, and stay healthy. This is Dr. Vinod signing off. Namaste. If you like this video or found it useful, don't forget to like, share, and subscribe. And if you want to be notified of further videos coming up, please do press the bell icon which is next to the subscribe button.